Thanks for tuning in to the Women's Vibrancy Code, a podcast dedicated to helping women move from exhausted to energized, balance their hormones, and feeling turned on by their life, their lover, and themselves. I'm your host, Maraya Brown. I'm a Yale and functional medicine trained women's health expert, midwife, mom, keynote speaker, and self-made entrepreneur. I'm the founder of my signature program, the Women's Vibrancy Code. So sit back, relax, and let's chat about your energy, hormones, libido, and embracing your feminine power. Oh, and you might want to have pen and paper to take some notes on some of these episodes. I would like to do a deep dive into breast health today. I was thinking that there's value there. It's a little bit didactic. First, just to acknowledge that we live in a very fast-paced world. And often when it comes to prioritizing our health or our prevention, it can take a backseat. But let's just call a spade a spade. We all have lots of responsibilities. And so I want to kind of dig into some of the breast health statistics. I want to talk about self-breast examination, the power of what self-breast exams can do, kind of how to do them. And then also talk a little bit about the hormones at play and estrogen dominance. I wanted to dig into the role of progesterone and contraception, and then some nuggets around kind of like empowering you with knowledge and awareness. And we'll see how it goes. And hopefully, as you have questions, just let me know. And I think that awareness and proactive measures are key to early detection and prevention. And there's some controversy around what that looks like, whether some are big fans of mammograms, some aren't. But I think no matter who you're talking to, everyone is going to agree that self-breast exams are kind of a non-negotiable. And then particularly for women in our 30s, our 40s, a lot of the women that I work with are in that age range. And so it's like, yeah, let's stay on top of it. So breast health statistics, breast cancer remains one of the most prevalent forms of cancer among women globally. According to the American Cancer Society, about 1 in 8 women in the United States will develop invasive breast cancer over the course of their lifetime. And early detection through self-examination and screening can significantly increase survival rates. And, you guys know me. I'm not a big fan of fear tactics. I believe strongly in law of attraction. So like I said that out loud. Now let's encapsulate it, Control, Alt, Delete, move that away because it's not part of our reality. And instead, let's kind of talk about proactive approach. So studies have shown that women who perform regular breast exams are more likely to detect abnormalities, leading to earlier diagnosis and more successful treatment outcomes. And most mainstream providers suggest mammograms as part of it, but I'm also going to talk a little bit about thermography. Those who aren't a fan of mammograms say that there is some radiation exposure with mammograms, and sometimes it can increase invasive procedures that weren't needed because there tends to be false positives with mammograms. And over the last 17 years, there have been pretty big changes in the frequency of when mammograms are suggested and the age that they start. So anyway, in either case, self-exams serve as a valuable supplement. What is thermography? Just to touch on it if you've never heard of it. Thermography is an imaging procedure first described in 1957 that screens for cancerous tissue, and it's using temperature differentials. So I've had a thermogram done, or thermography, and literally I've had a mammogram too. So stand topless, kind of with my back against a wall, and there's a machine, say, maybe 10 feet away. And it's literally just detecting temperature differentials and then spits out a photo of my chest and breast tissue looking at temperatures. And the thought, so it's using an infrared camera, and the thought is that malignancies are usually warmer because there's more blood flow to that area than normal tissue. And it also relates to the production of nitric oxide, which produces local, what's called vasodilation first. So the blood flow, the capillaries or the arteries, whatever it may be, are dilating, they're getting bigger, so there's more blood flow to the area when there are cells changing rapidly in the direction of cancer. And so this promotes blood vessel growth, and then there's more blood flow, and then it goes to the tumor, and so then there's a higher rate of metabolism in the cancer cells. And so for individuals that are using thermograms instead, it's just simply using temperature rather than a mammogram. Okay, so let's talk about self-breast exams. They're very simple, and my ideal is that we do them once a month. We get to know our own breast tissue because everybody's breast tissue is different. Some of us are more firm, some of us aren't so firm, especially if depending on your age and if you've breastfed and for how long you've breastfed. Some of us have more kind of naturally lumpy, bumpy texture, which sometimes is referred to as fibrocystic. And so the more that we get to know what's normal for us, then if we feel something that feels like it's different or it's changed or an abnormality, we kind of have a better idea of what to do. So kind of step by step on how to do a self-breast exam. First, you're going to choose a comfortable setting, find a place that feels quiet and you're not going to be interrupted. I generally will do it in the shower. I like to do it after I'm done bleeding. Generally, for the week before you bleed and during your menstrual cycle, sometimes your breast tissue can just be a little bit more sensitive. Some women, their breast tissue is more sensitive when they're ovulating. So you get to kind of, based on your body and when your breast tissue is less sensitive, that's the ideal time to do it. And we're going to do this once a month. Okay. So we get into position, you're going to, what I was taught. So when I was at Yale, I was taught to teach the NPs, PAs, and med students how to do a breast exam that was respectful and kind and honoring a woman's body. And it used to be that the teaching was to do concentric circles around breast tissue. But the latest and greatest that I was taught and what I taught the med students was more like down, over, up, over, down, over, kind of like you're mowing the lawn or vacuuming, so to speak. And so what you're thinking is kind of light, medium, deep. Okay, so you're making little concentric circles with your fingers. It's easy if you do this in the shower because you already have soap on your body. It's a little bit more slippery, right? And so you're just making little circles, light, medium, deep, light, medium, deep, down your sternal, in the center area, down to your bra line, over, up, over. And remember, breast tissue literally is going to go all the way up to your clavicle. We don't think of breast tissue up into this corner, but it really does. So you're literally going up to your clavicle and even out to the shoulder notch. And so you're just thinking, okay, really light, like a feather, a little bit deeper and a little bit deeper, and you're covering the entire tissue. And what you're feeling for is anything that feels abnormal. I'll get into that. So then once you've covered your whole breast tissue, you've done light, medium, deep, and kind of done your own self-breast exam, you're then going to stand in front of the mirror with your arms relaxed at your side and still topless, and just take note of the appearance of your breasts. Okay, you're looking for any changes in size, shape, or contour. Okay, you don't want to see changes in texture. We're looking at nipple position. And any signs of dimpling or puckering or redness, those are generally things to just catch your eye, kind of alarming, so to speak. And then you'll take your arms, you swing them up above your head so that your palms are facing one another above your head. And while you're doing that same thing, you're watching your breast tissue. You're watching how the breast tissue moves. And once again, you're looking for dimpling, dragging, lumps, and that would be something that would be a concern. Okay. Otherwise, you're looking for changes in symmetry, changes in nipple direction. Many women have actually inverted nipples. It's totally normal. For those of you that have inverted nipples, especially when it comes, just to say out loud, some women are like, am I going to be able to breastfeed? Yes, you can breastfeed if you have inverted nipples, but just pay attention to, I know my body. Is anything changing, right? And then you're going to lower your arms and down to your side and just continue to watch. Okay. When it comes to the palpation that I mentioned, if you do it in the shower, you can also do it laying down, right? If you want to be on the bed and maybe you're going to use some lotion or jojoba oil, whatever you're going to use. Okay, so you're going to use the pads of your finger, and like I said, little circular motions, and then you go up, over, down, over, um, and applying different pressure regarding what you're looking for. Um, I'm tr- I just want to say out loud, with your nipples, there is value in gently squeezing them. And just make sure, just, with your thumb and your index finger, check for any discharge. Okay, it's very unlikely that there will be any nipple discharge, but if there is, especially if it's only from one side and you're not recently pregnant, that's generally a reason to call your provider and say something's going on here, or if the nipple texture is changing. Um, if you, while you're doing a self breast exam, if you do feel something that feels like a lump, let's say, first thing to do is go, okay, what is this? Feel around the same breast, feel around the other breast. Go, do I find something that feels the same somewhere else in my breast tissue? If you do, that's much less alarming. Okay. Whereas if you feel something that feels hard, immovable, persists over time, and it's definitely different than anything else you feel anywhere else on that breast or another breast, it's generally always a reason to call your provider and just ask to be seen. Other things to think about when it comes to if you do feel something that feels like a lump. And I just want to remind you, many women have what I call lumpy, bumpy breasts, for how long? For 11 years, I ran the women's health in lots of different places, and I did lots of annual exams, lots of breast exams. Just to take note, if you do have breast implants, it does make it a little bit more difficult depending on where the breast implants are. But nonetheless, still do these, right? Still do your monthly breast exams. Regarding the lump, okay, if it's larger than the size of a pea, or you notice it and then you continue to kind of watch it for the next week, month, whatever it may be, and it's growing in size, that is always a reason to call your healthcare provider and have it evaluated by a healthcare provider. Generally, they're going to order an ultrasound, and often not just a regular mammogram, but what's called a diagnostic mammogram, which is much more thorough. We're thinking texture. Okay. Does the lump feel distinctly different from the surrounding breast tissue? Often harder or firmer, or you can feel distinct edges or lumps. And it's definitely different than anything else. Talking discomfort or pain, while most breast lumps are not painful, the presence of pain or tenderness in a lump does not necessarily rule out the possibility of breast cancer. So that's one of those that's like, well, usually a lump that's concerning is not going to be painful, but even if it is, that doesn't mean don't see your healthcare provider, particularly if it feels distinctly different than anywhere else, if it's firm and if it's not movable. We're looking for skin changes, such as changes in the skin texture. Like I said, dimpling, puckering, redness, thickening. Sometimes those will kind of be over the lump, and they can indicate underlying tissue. And then obviously taking into consideration family history, right? So while you're doing self breast exams, if you know that you have a family history of anyone who's had breast cancer, ovarian cancer, or colon cancer, and you feel a lump, well, that's a reason to go a little bit sooner. Just call your healthcare provider, go in, allow them to do an exam themselves, get an ultrasound, especially with an ultrasound for the individuals that are super opposed to mammograms or diagnostic mammograms. At least do an ultrasound just to take a closer peek. And just to take note that not all breast lumps are cancerous, and many, even most, are benign. And even benign conditions can cause lumps in breast tissue. Okay. Remember that estrogen is proliferative. Estrogen creates tissue. It builds the endometrial lining. It also builds breast tissue. And just to say out loud, any new or concerning lump should always promptly be evaluated by a healthcare professional, and to determine the underlying cause. And that can be your PCP, that can be your OBGYN, that can be your naturopath. Most everybody is going to be trained in how to do a breast exam and order an ultrasound. I will advocate for making sure that if they're going to order a mammogram, make sure it's a diagnostic mammogram. I do have a few women that I know that went in, said they felt a lump, and their provider was not super proactive, and then wasted time in the diagnosis of breast cancer. And there's always the woulda, shoulda, coulda. But to be in the place of self-advocacy, if you feel a lump and you're okay with a mammogram, then definitely go to a diagnostic mammogram and an ultrasound and having your provider do the exam. Let's think. I said to perform regularly, at least once a month. I generally, once a month is just fine. I shouldn't say at least. It should just be part of your breast health routine, part of your daily hygiene, but do it once a month. And you'll find the time, I think in general for most women, a few days after your menstrual cycle has ended. If you're beyond menopause, then you're just doing this once a month, right? Maybe you're going to mark the calendar. Maybe you're going to take note of any time there's a new moon. That's when you do your breast exam. And like I said, that's a time when your breasts are less likely to be swollen and tender. And then remember, while breast examination is essential for breast health, it's not replacing a clinical breast exam. Okay, so, and even with the changes in the frequency of how often we do pap smears these days, I mean, some, depending on your age, you're only getting a pap smear once every 3 years, once every 5 years. But it's important that we remember that there's still value in going into your provider once a year to have a physical exam. And that should include a breast exam. That should include palpation of the abdomen. That should also include a pelvic exam where they're actually inserting 2 fingers inside your vulva, pressing on your belly, feeling your uterus, feeling your ovaries, examining your cervix with their fingers. I think the big thing that I would say, if you have strong family history of breast cancer, and if you know if that family member did have the BRCA gene positive, before you have the testing done, be clear with what am I going to do with the information. So if you're the type of person where you're already going to be proactive with self-breast exams, you're making a really concerted effort with your nutrition and cleaning up toxins and making sure you're not being exposed to endocrine disruptors. And it's possible that getting a BRCA gene positive is going to send you into big, big, big anxiety and stress you out. Stress also doesn't benefit the long-term prevention of breast cancer. Whereas if you're the type of person where you're like, no, I would want to know, I like to be proactive. I would rather know sooner rather than later. And maybe I would choose to get a double mastectomy. Like Angelina Jolie, that was a big thing that she did and became kind of popular, or at least it raised awareness. So I think if you're thinking about doing the testing, I would just get quiet with yourself ahead of time and get clear with what am I going to do with this information, depending on which direction it goes. And I always use the BRAIN acronym. Hopefully you guys have heard me say it before. If you haven't, I'll say it again. And this is with any decision. You want to decide about what college to send your kids to, or whether to take a vaccine, or to do a certain test, or get a tattoo. I mean, whatever it is, if you're in the place of examining, do I want to do this intervention? I like to use BRAIN. So BRAIN. B stands for benefits. R stands for risks. A stands for alternatives, and I'll go over this again for those of you that are writing fast. A stands for alternatives. I stands for intuition, and you save that one for last. N stands for either next steps or doing nothing. So B, benefits. You're telling me I need to do this intervention. What are the benefits, right? Ask your provider, what are the benefits? Ask your coach, ask your family members, do some research. What are the benefits? Risks. If I do this thing, what are the risks? If I don't do this thing, what are the risks? A, what are all my alternatives? Right? What else might be out there and possible, especially when I was teaching childbirth education classes and women were getting ready for childbirth. There's so many choices, right? Do I want to give birth in a hospital? Do I want an epidural? If I have GBS positive, do I want to do the antibiotics, right? Do I want to give my baby a Hep B vaccine before they leave the hospital? So they're spending a lot of time kind of diving into this. And we go, okay, what are the alternatives? What other options might be out there? And that's when you get to ask your provider, keeping in mind that we can't ask people directions to places they haven't been, right? We're using discernment with where's their education. So if your provider is a mainstream allopathic doctor, you might ask them what are the alternatives, but you might also do some research other than just with your doctor, right? Can you find alternative providers? Do you have friends that tend towards a more alternative approach and go, what might my other options be? What if I did a thermogram? What if I did castor oil massage? Like, what are my other options? And so BRAI is my intuition. So I'm going to save that for last. N is what if I do nothing? What if I just wait? Right? Or if I choose to say yes to this thing, what will be my next steps? And then once you've gathered all of the information, all of the data, you then go get quiet and you say, what does my intuition say? Like, what does my inner guidance say? What do I know to be true for me? And so when you're thinking about the possibility of doing the BRCA gene testing, I think that that's a valuable process to go through, particularly if you once again have family history of breast cancer, ovarian cancer, colon cancer. Now, cervical cancer, not genetic, not a concern. Okay. Uterine cancer, most of them say not so much a concern, although, there's no harm in at least talking to your provider. Okay. Good. If we talk about hormones, I think estrogen and progesterone are the big ones that I want to talk about. So estrogen dominance is definitely a factor in predisposition towards developing breast cancer. And it's really characterized by an imbalance between estrogen and progesterone. Not necessarily that your estrogen is high, so to speak, but that it's high in relationship to the progesterone. It's not being balanced. It's not being counteracted by the progesterone. So it's what we call unopposed estrogen. Okay. And it's been linked to various health concerns, including breast cancer is one thing. And part of it, we go, well, what's going on here? Is it because we're not ovulating well and so we're not producing progesterone? Is it that we were on birth control for a long time and added in a lot of excess estrogen? And the progesterone in birth control is not progesterone, it's progestin. Also, modern environment, we're exposed to a lot of endocrine disruptors and chemicals that interfere with hormone balance on a daily basis, right? Our beauty care products, our plastics, the air we breathe, the water we drink. And these disruptors can be found all over the place. Pesticides, particularly for those of you that live in the US, depending on what country you're in, like in Europe, there's much more stringent regulations around what their equivalent to our FDA allows in beauty care products. Or use of pesticides and herbicides in growing. And so in the US, we're definitely exposed to a bit more. And so it becomes that much more important to go, okay, how can I make efforts to clean up my personal care products, to get plastics out, to eat produce that is organic, even though it's more expensive. I'm investing in my wellness today so that I don't have to pay more greatly down the road. Okay. So endocrine disruptors mimic estrogen in the body, and they contribute to estrogen dominance and increase the risk of hormone-related conditions like breast cancer. So to try to mitigate those, we want to try to decrease exposure. We want to make a concerted effort to help keep progesterone levels elevated. It's one of the reasons why I love looking at the Dutch Plus test. We're looking specifically during day 18 to 22 so that you're in your luteal phase. Ideally, you've ovulated and we can see that the progesterone is rising, and we want to make sure that that progesterone is balancing out the estrogen in your, PMS week or luteal week or fall time, however you want to see it. But then also estrogen dominance is going to be associated with fibroids, heavy bleeding, menstrual migraines. Okay. Endometriosis. They're saying that estrogen dominance can contribute to the growth of proliferation of endometrial tissue outside the uterus, which can then lead to inflammation and pain and fertility. PMS symptoms. Okay, when a woman has estrogen dominance, there is once again this imbalance, and it can exacerbate symptoms of PMS, including mood swings, bloating, breast tenderness, and irritability. So I just want to say out loud, making sure that we're addressing the estrogen dominance is not just for breast cancer prevention, right? Uterine polyps is another thing. Excessive estrogen stimulation can promote the growth of abnormal tissue within the uterine lining, leading to formation of uterine polyps, which can then cause heavy bleeding, painful bleeding, pelvic pain, sometimes can lead to cancer, a little bit less likely. I had cervical polyps, which the jury is out. The cervical polyps are very rarely associated with cancer. I think like 5% of them, but and they are saying that it's not necessarily associated with estrogen dominance, but I'm so curious. Also, estrogen dominance can be associated with weight gain and metabolic issues. A woman who has excess estrogen is often going to carry more of her weight in her hips and her thighs, and generally breast tissue. And then mood stuff. So elevated estrogen levels can also impact the neurotransmitter activity in the brain, contributing to mood swings, anxiety, depression, and other mental health issues. So there's lots of reasons to address the estrogen dominance, not just preventing the potential for breast cancer. I do want to say out loud that there's a lot of hoopla around soy. I am actually a fan of soy as long as it's organic and non-GMO. We have a couple different estrogen receptors, and I'm not going to go too far into it, but there's alpha and there's beta, okay? One has a strong link to the development of breast cancer. The other one doesn't. So when we're getting in foods that are what are called phytoestrogens, or they're high in food-based natural sources of estrogen, the research that I've read and the experts that I listen to and trust say that the phytoestrogens are actually going to help balance that estrogen level. They're addressing the estrogen receptor that is not linked to breast cancer. On the other hand, we're seeing reduction in breast cancer. There's been really phenomenal research done out of Japan with women who have a diet very high in quality soy, and it's showing a statistically significant reduction in the propensity towards breast cancer. But it's with the caveat that it's non-GMO and it's organic. Okay, that does not mean soy supplementation, right? That does not mean isolated isoflavonoids. I'm actually saying soy as a food. Okay, same with ground flax, primrose oil. There's a lot of our fruits, vegetables, and berries are going to bring in natural phytoestrogens, which are actually linked to decreasing estrogen if it's too high, or helping bring estrogen up if it's too low, and has been associated with breast cancer prevention. All right. Whereas hormone replacement therapy, depending on what form of estrogen is being used, that we're kind of, the jury's out, right? The WHI study it was a huge study. And in 2000, it was shut down preemptively. Before that, all women in perimenopause were put on HRT. And then they were like, oh no, increase of breast cancer, increase of stroke. Now, I interviewed Jill Shimoleski and Dr. Rosensweet. They are part of the Bioidentical Hormone Replacement Therapy Institute, which is one of the largest institutes really advocating for women having access to hormone replacement therapy as we age. And they're saying that study was not done well, and the way that they were looking at it needs to be revisited. So I think the big thing I want to say there is, if you are adding estrogen from a hormone replacement therapy conversation, it has to be balanced with progesterone, not progestin, progesterone. I'm surprised at how many women will come in and their OBGYN has put them on estrogen, but not progesterone, because they say, well, you're not bleeding anymore, or well, you don't have a uterus. And I go, okay, but estrogen and progesterone are not just for our bleeding. Progesterone plays a huge role in our mood and our overall wellness and our stability and helping to balance out that estrogen. So that's a big conversation, but I just wanted to touch on it. Speaking a little bit more about progesterone, and hopefully you guys are taking this all in. I'm covering a lot, and you can always go back and listen again, take your notes. But I really wanted to kind of cover all of my bases on this topic. So, the role of progesterone in hormone balance. Progesterone plays a crucial role in balancing estrogen, like I said, promoting overall hormonal harmony in the body. Okay. Once again, when estrogen levels are elevated without sufficient progesterone to counterbalance them, we've got estrogen dominance. Okay. And I've talked about all of the kind of long term detrimental effects there, breast cancer being one of them. Okay. It can lead to symptoms like I've already mentioned all of them, but incorporating lifestyle strategies to support healthy progesterone levels, such as stress management, adequate sleep, proper nutrition. If you're still ovulating, really supporting healthy ovulation and maintaining hormonal balance. Looking at a Dutch Plus test so we can look at quantifiables. There are some B vitamins that are definitely associated with healthy progesterone levels. And, go back to the conversation around the cyclic nature of estrogen and progesterone. During our luteal phase or our fall time or our PMS week, however you want to see it, that's progesterone dominated. Okay. Progesterone hides when cortisol is high. Okay. If we are pushing ourselves, if we are over exercising, if we are overdoing intermittent fasting, if we are limiting carbohydrates are essential for progesterone to be produced. Okay. So sometimes it's simply our lifestyle that is making progesterone hide. Okay. And it's not being produced. And we want that progesterone on our side for all the reasons we've talked a bit about. Okay. So some other things that help from a supplemental perspective to support progesterone would be Vitex, wild yam cream. And then obviously for some women, they go on bioidentical progesterone orally at night before bed. This is one of those, when it comes to estrogen, I'm not super attached to estrogen having to be bioidentical versus synthetic. For progesterone, it is essential that it's progesterone, not progestin. So I'm a pretty stickler when it comes to, if you're going to do progesterone, make sure it's bioidentical. Talking a little bit about contraception. Obviously, if you are in your fertility years and you want to prevent pregnancy, that's important, right? An unplanned pregnancy has all sorts of influence that I don't need to get into. That's just, it is what it is. So there's this place of, yes, let's advocate for contraception that really works for you. And everybody's different, right? Some people really don't want an IUD. Some people don't want an implant in their arm. Some people won't remember to take a pill every day. Some people really know their bodies well and use fertility awareness method and do it well. In my scenario, for the last 20 years, I've used fertility awareness method because my menstrual cycles are regular. I know my body and it's worked 100% of the time. That doesn't mean that that's what works for everybody. But I want you to know that when you go on contraception, particularly the pill, the patch, the ring, all of those are going to have estrogen in them, and it's going to impact the estrogen levels in your body. There's a book called Your Brain on the Pill, written by Dr. Sarah Hill. And I interviewed her. That interview is in the podcast way, way early on. Like it was in one of the first 5 episodes. And it's really fascinating to see what we're learning about women who go on the pill. And one of the big things is, for some reason, it sends the adrenals into hyperdrive and they lose that negative feedback loop, meaning cortisol is just being pumped out, pumped out, pumped out. And so that's not necessarily linking directly to breast cancer, although it is. Because when cortisol is being overproduced, that means stress. The body is perpetually perceiving that it's under stress, which is going to increase inflammation, which is going to impact the gut, which is going to impact our thyroid, which is going to impact our overall wellness, right? And our immune system and our body's ability to stay well. So just know that we have to make educated decisions. And if you're going to be on estrogen, number one, if you have any history of migraines with aura, you should not be on estrogen, okay? If you have a history of something called von Willebrand's, which is a genetic thing related to clotting, you don't want to be on estrogen. But also, if you have a strong family history of breast cancer, it is something to consider, to go, all right, do I have another option, such as the IUD, such as fertility awareness method, such as Depo is my absolute last choice. I despise it. But the arm implant, maybe. There is a progesterone only pill, but once again, it's progestin. It's not progesterone, but at least it offers some contraception. You do have to take it the same time every day, and it doesn't have estrogen in it. So for women concerned about breast health, it's essential to really discuss all of the pros and cons, either with me or your healthcare provider. Ask friends, really do your due diligence. And there are non-hormonal options. So there's the copper IUD, there's barrier methods, right? Diaphragm, condom, and then, like I said, fertility awareness method. Okay. Taking a breath. The last thing that I just want to say is just kind of wrapping it up. And to say, as women, we have the power to take control of our health and well-being, right? By staying informed about breast health, practicing regular self-breast exams, and advocating for our hormonal balance, we can empower ourselves so that we can feel vibrant and healthy. Paying attention to diet, I didn't touch on that, but it could be an entire episode, okay? Keeping your processed foods and fried foods and bad fats out of the diet, right? Keeping stress levels low. As a general rule of thumb, eat a lot of fruits, vegetables, and berries. You're never going to go wrong, okay? If you just go, all right, every time I eat, half my plate is fruits, vegetables, and berries. I'm getting a wide variety of color. I'm getting a wide variety of nutrients. I'm getting a wide variety of fiber, which is supporting my inflammation reduction. It's supporting my gut health. It's keeping the anti-aging conversation going, right? And I'm paying attention to not eating all the processed crap food with the preservatives and pesticides. Like, it's not serving you. And what happens is, over time, something called metabolic programming sets in, which pretty much what that is that we crave what we eat. Okay. So as you start shifting what you eat, your body will start craving different things. Okay. So as you eat more fruits and vegetables, your body will start craving more fruits and vegetables. It's one of the reasons why I love Juice Plus so much. And I generally advocate for everybody to add it, is you're taking little bits of lots of different fruits, vegetables, and berries that are, tested to be herbicide, pesticide free, picked at the peak of ripeness, flash frozen, pulverized, dehydrated, encapsulated. So you can take these little capsules every day, kind of bridge that gap between what you're eating and what you would ideally be eating. And it has that kind of homeopathic influence where you're sneaking it in. And then metabolic programming sets in and people start going, wow, I'm craving broccoli for the first time. Or I'll have women say, my husband just sat down and ate a salad. He's never eaten a salad in all of our marriage. And it's metabolic programming at work. So as you start making changes with your nutrition, it literally will start shifting what you crave. The last thing I want to say is early detection saves lives. Okay. So really, truly, if there's one thing that you take from this, it's make self-breast examination a regular monthly part of your health routine. And don't ever hesitate to meet with your healthcare provider if you notice any changes, if you see them, if you feel them, if you're like, I don't know, but this just feels different than anywhere else on my body, just go be seen. Okay. And then, we can all prioritize our foundational well-being and create a sense of brighter, healthier future for ourselves and also generations to come. All right, you guys are awesome. Thanks for sticking with me and letting me kind of dig into more of a heady, big topic.